Imagine waking up full of energy, moving with confidence, and feeling strong after 40. Although science says that from that age sarcopenia appears, that silent loss of muscle that steals independence, you are not doomed to live weak. The truth is, there is a set of functional exercises that can reverse that decline. And the best part, you don't need weights or a gym, just a few movements that train your body as a whole. That's why today I want to show you some of these exercises, and also how to do them correctly and adapt them to your level, so you can start building strength, balance, and confidence from today. And if you enjoy this content, don't forget to subscribe and give us a like, and tell me where you're watching from. We love to read your comments. Let's get started. Exercise 1, burpees. When someone adds this exercise to their routine, what they achieve is a complete workout that combines strength, coordination, and endurance at the same time. Each repetition activates the lower body, with the quadriceps, glutes, and hamstrings as the main drivers of the push, the core and lumbopelvic muscles keeping the spine stable, and the upper body, where shoulders, chest, and triceps work together to support body weight during the plank phase. This integration makes the burpee a functional movement, useful not only to improve physical condition, but also to face daily tasks with greater ease, such as standing up, bending down, or maintaining balance in different positions. This type of exercise is highly recommended in physical conditioning, because it not only activates the muscles, but also reproduces movement patterns that the body needs to preserve over the years. Beyond the immediate demand, what truly makes it valuable is its ability to train strength, endurance, and mobility at the same time. According to the journal Sports Medicine, multi-joint exercises that involve large muscle chains generate significant improvements in both cardiovascular capacity and functional strength in adults of all ages. In addition, the Journal of Aging and Physical Activity highlights that movements involving transitions from the ground to standing position strengthen autonomy, reduce fall risk, and boost confidence in daily mobility. In other words, every burpee performed not only strengthens muscles, but also trains the nervous system and joints to respond more safely in everyday life. And the best part is that this exercise is easy to practice, as long as you respect the technique. In its classic version, you start standing, bend your knees to place your hands on the floor, extend your legs back into plank position, then return with an explosive motion that ends in a small jump. However, when it comes to older adults, who may experience joint discomfort or stiffness, it is better to use an adapted version. Instead of kicking both legs back at once, you can step them back one by one, reducing strain on the lower back and knees, and instead of finishing with a jump, you can simply rise gently and lift your arms. That way, the burpee keeps all its benefits of strength, endurance, and coordination, but adapts to the real needs of each person, making it safe and progressive. Exercise 2, mountain climbers. By including this exercise in your routine, what you achieve is a dynamic, yet controlled, stimulus that involves both the lower and upper body, with a special demand on the central area of the body. In each movement, the hip flexors work in coordination with the quadriceps to drive the knee forward, while the glutes and hamstrings act as stabilizers, preventing the pelvis from shifting excessively. At the same time, the core is constantly engaged, especially the transverse abdominis and the internal obliques, which are responsible for fixing the spine and holding the trunk without collapsing downward. The shoulder girdle also plays an intense role. The shoulders, the serratus anterior, and the triceps sustain the plank posture, which guarantees complete control of the upper body. This interaction turns the mountain climber into an exercise that not only improves cardiovascular endurance, but also sharpens neuromuscular coordination, a key factor for moving with stability and safety in daily life. Now then, the importance of this exercise does not lie only in the feeling of effort, but in the proven benefits it provides. For example, the Journal of Geriatric Physical Therapy has documented that movements which reproduce walking patterns, such as mountain climbers, promote hip mobility and improve dynamic balance in older adults. In the same way, a study published in The Lancet Public Health highlights that controlled core activation in isometric positions with leg displacement helps prevent lower back pain and optimizes posture, especially in people who spend many hours sitting. These findings show that every set of mountain climbers acts as a functional, low-impact training session, capable of strengthening deep muscles, improving intermuscular coordination, and, in the long run, reducing the likelihood of injuries in everyday activities as simple as walking long distances, climbing stairs, or maintaining balance on uneven surfaces. That is why it is a movement that combines effectiveness, safety, and accessibility, fundamental aspects for those who want to preserve their physical independence over the years. In practice, this exercise is easy to implement, provided that the proper guidelines are followed. The traditional version consists of placing yourself in plank position, with arms extended and hands under the shoulders, keeping the body in a straight line. From there, you alternate driving your knees toward your chest, making sure the hips neither rise nor drop. However, when we talk about older adults, or those who experience joint discomfort, it is possible to opt for gentler variations. For example, placing the forearms on the ground instead of the palms, to reduce wrist tension, or performing the exercise with hands on an elevated bench, thereby decreasing the load on the lower back. You can also slow down the rhythm, turning the mountain climber into a slow and mindful movement, where what matters is not speed, but control. With these adaptations, the mountain climber becomes a versatile and safe tool, capable of delivering all its benefits without exposing the joints to unnecessary impact. And if you've made it this far and enjoy our content, don't forget to subscribe. Exercise 3, Side Plank. Among the most effective positions to strengthen the midsection, the side plank stands out, an exercise that trains trunk stability from a different angle than usual. By holding the body sideways, supported on just one forearm, the obliques come into action, responsible for controlling lateral tilt and keeping the spine straight. Alongside them, the transverse abdominis and the spinal erectors act as a protective belt around the core, preventing the back from collapsing. The hips also play a fundamental role. The glutes, especially the gluteus medius, are activated to support the pelvis and maintain body alignment. Added to this is the participation of the supporting shoulder muscles, the deltoid, the serratus anterior, and the trapezius, which stabilize the scapular joint and allow the weight to be held firmly. This entire set of actions turns the side plank into an exercise that combines control, endurance, and balance, qualities that are essential for moving with safety and confidence in everyday life. The usefulness of this posture goes far beyond localized strength. And also, various studies demonstrate its value, positioning it as a tool for prevention and care of musculoskeletal health. The journal The Lancet Public Health has pointed out that isometric exercises, such as the side plank, significantly reduce the incidence of lower back pain and help improve posture, especially in middle-aged and older adults. Likewise, research published in the Journal of Strength and Conditioning Research found that the activation of the obliques through this type of support increases balance and reaction capacity, two factors directly related to the prevention of falls. This means that every second spent holding the position not only strengthens the muscles, but also trains the nervous system to react better in situations of imbalance, which has a positive impact on autonomy and personal confidence. In practice, incorporating the side plank into a routine represents a long-term investment in health. It improves coordination between the hips and the spine, protects the joints, and provides an extra layer of safety to everyday movements. As for execution, the procedure is clear, although it requires concentration. You begin lying on your side on a stable surface, placing your forearm aligned with your shoulder. Then, you lift the hips until the body forms a straight line from head to feet, keeping your gaze forward and avoiding tilting the trunk forward or backward. The recommendation is to hold the position for a few seconds, always prioritizing technique over duration. Now, if you are an older adult and want a more accessible option, you can perform the same posture with the knees resting on the ground, which decreases intensity without losing core activation. And if, during practice, you feel discomfort in the supporting shoulder, a valid option is to perform the side plank with the forearm placed on a bench or raised surface, thus reducing pressure on the joint. Thanks to these variations, the exercise can be adapted to different fitness levels, while always preserving its essence, strengthening the midsection, improving stability, and providing greater safety when moving in everyday life. Exercise 4, Pull-ups. Among the most effective pulling movements to strengthen the upper body, pull-ups stand out, an exercise that challenges both strength and coordination. While performing them, the back muscles are the main protagonists. The latissimus dorsi and the teres major work intensely to lift the body upward, while the rhomboids and the middle trapezius assist in scapular retraction, which is essential for maintaining proper posture. At the same time, the biceps and brachialis provide the necessary arm strength, while the forearm muscles take care of the grip, a key detail because it improves hand endurance and grip strength, qualities directly linked to functional independence. We also cannot forget the role of the core, which acts as a stabilizer to prevent excessive swinging. This combination of actions makes the pull-up a global exercise, one that not only develops the back muscles, but also has a positive impact on posture, body control, and confidence in everyday movements. The importance of this exercise has been supported by scientific evidence, which considers it one of the best strategies to maintain strength and bone density in adulthood. For example, the Journal of Bone and Mineral Research points out that gravity-resisting pulling exercises, such as pull-ups, stimulate bone tissue and help prevent osteoporosis, an especially relevant factor for women and men over 50. In addition, research published in the European Journal of Applied Physiology highlights that grip strength training, which is directly improved with this exercise, is linked to a lower risk of falls and a higher chance of living independently for longer. These results explain why pull-ups are such a valuable resource in any conditioning program. They do not just strengthen the back and arms, but also contribute in an integral way to maintaining body functionality, reinforcing the ability to perform daily tasks such as carrying bags, opening containers, or holding weight without fear of losing control. In other words, practicing pull-ups regularly means investing in stronger muscles and a better quality of life. When it comes to practice, the classic technique consists of hanging from a fixed bar with the hands shoulder-width apart and palms facing forward, then pulling the body upward until the chin passes the bar, and finally lowering in a controlled manner. However, it is not always necessary to start with this demanding version. Now, if you are an older adult, or if you do not yet have the strength to complete a full repetition, there are highly effective variations. One option is to perform assisted pull-ups with resistance bands, which reduce part of your body weight and make the movement easier. Another alternative is the inverted row under a low bar, with the feet on the floor and the trunk inclined, which allows you to train the same muscle chain with less demand. And if what you are looking for is joint safety, gym machines with counterweights also provide an accessible version. With these adaptations, pull-ups are no longer an exercise reserved only for young athletes, but become a progressive and safe tool for anyone who wants to improve back strength, posture, and stability in everyday life. Benefits. And what is the real purpose of doing these exercises? The answer goes far beyond simply moving your body, or sweating a little during the routine. Practicing burpees, mountain climbers, side plank, and pull-ups consistently provides benefits that transform not only muscle strength, but also the way you move, your daily energy, and the confidence you have in your own body. Each repetition acts as an investment in health, because these movements train complete muscle chains, improve coordination, and increase cardiovascular endurance. But most importantly, all of this is reflected in everyday life, getting up with ease, walking long distances without fatigue, bending down without pain, or keeping your balance on uneven surfaces. What may at first seem like just an exercise, is actually functional training for your independence and well-being. Now then, why do these exercises really work? Because they do not target a single muscle in isolation, but instead activate complete chains that make your body function as an integrated system. That is the key that turns them into movements with visible, and above all, practical results for daily life. By involving several joints at the same time, you improve not only strength, but also coordination and balance, thereby reducing the risk of falls. In addition, since large muscle groups are activated, your heart also benefits, improving its capacity and your overall endurance. And there is another very important point: by challenging the body with the resistance of your own weight, these exercises also strengthen your bones, which helps to keep them firm and prevents problems such as the loss of bone density with age. However, exercise alone cannot be considered the absolute solution. If someone trains but neglects their nutrition, their rest, or ignores signs of pain, the results will be limited. That is why science insists so much on a holistic approach. Physical activity must be accompanied by proper nutrition, restorative sleep, and regular medical checkups. A balanced diet, that includes quality protein, complex carbohydrates, and healthy fats, reinforces the effects of training and accelerates recovery. In addition, micronutrients such as calcium, magnesium, and vitamin D play an essential role in bone and muscle health, while hydration ensures that every system in the body functions properly. Another important aspect is learning to listen to your own body. Exercise should be an ally, never a source of disabling pain. If persistent discomfort appears in the joints, muscles, or lower back, the wisest choice is to consult a doctor before continuing. The point is not to stop, but to adapt the routine so that it fits each individual's needs. Ultimately, these exercises go beyond the physical dimension. They shape the way the body connects with the mind, they strengthen personal confidence, and they provide independence to carry out even the simplest activities with assurance. Each training session becomes a reminder that well-being does not depend on great sacrifices, but on small, consistent habits that, over time, transform life. To conclude this journey, it is important to emphasize that the consistent practice of burpees, mountain climbers, side plank, and pull-ups offers an advantage that goes far beyond strength or endurance. It builds a body prepared to move safely, and a mind confident in its abilities. We have already seen that the benefits are multiple, from improving balance and posture, to preventing falls, strengthening bones, and increasing cardiovascular endurance. But the most valuable aspect is how all of this directly impacts daily life. Getting out of bed with energy, walking long distances without exhaustion, bending down without fear of injury, lifting weight with confidence, these are simple gestures that, thanks to training, stop being obstacles and become natural, fluid actions. This path toward a stronger body and a more active life is not based on miracles, nor on extreme workouts, but on consistency and gradual care. Exercise, when performed correctly, and combined with good nutrition and attentive listening to your own body, becomes a powerful tool to preserve autonomy and to fully enjoy every stage of life. And in fact, the real goal is not only to train muscles, but to maintain independence, vitality, and the ability to enjoy the small pleasures of everyday life. So, if you have made it this far, now is the time to take one more step. Start incorporating these exercises into your routine on a regular basis, adapt the versions to your level, and experience firsthand how your body responds with more strength, more energy, and more confidence. And to keep learning together, don't forget to subscribe to the channel, leave your like, and activate the notification bell. Your support makes it possible to continue sharing more routines, tips, and content that will help you stay active, healthy, and motivated every day.